The last type of genetic testing of the embryo I want to discuss is a little difficult to understand. It's called PGT-P. It is really profound, but it's a little hard to understand, and it's going to require some thinking about evaluating whether you want to go through this or not. PGT-P stands for plurigenetic diseases. Now, we know that rare diseases like cystic fibrosis or muscular dystrophy are caused by common mutations. I mean, 4% of us have a recessive mutation for cystic fibrosis. It's very, very common. Carrier status results in rare diseases if both the couples have it. However, the most common diseases like high blood pressure and heart disease and cancer, these are caused by a huge variety of rare genetic mutations, and these mutations have to combine together to cause the disease. So if you just have one mutation in a particular area, that's not going to cause the cancer or the high blood pressure or the diabetes, except for BRCA. That's the only exception. But by and large, it's an unusual combination of rare sequence variants in the DNA that are not even called mutations, because those sequence mutations don't really cause any disease. They're just there and they're different. But when you combine so many of them together, just that is able to determine whether you're at risk for diseases like blood pressure or diabetes or cancer or heart disease. Okay, so I tried to explain something very complicated. What we can do now is biopsy the embryo and with AI look for these combinations. And by looking for these combinations, we can't make an exact determination, but we can tell you what your risk is, or what your child's risk is, for developing one of these diseases in their adult life, whether they're going to develop diabetes or heart disease or cancer or hypertension. We can make a score as to what is their relative chance of having this disease later in life. And then we can just transfer the embryos that have the lowest score for risk of adult disease. So in a sense, it's a child that can look forward to a healthier life in the future. And it's only a risk and a percentage, and it's not absolute. So this is something that many couples that are not infertile but have a family history of all kinds of awful things might want to take advantage of. So that's the final one, PGT-P. When we have our consultations, we can talk about any of these options for genetic screening and genetic biopsy of the embryos. Just bring it up if you're interested, and we'll talk about whether it's a good idea for you or not.